Here at Aboriginal Health, and if you're joining us from anywhere within the Vancouver Coastal Health region, from Whistler southward, then you are also on the unceded homelands of the Musqueam, Tsleil-Waututh, and Squamish nations. On behalf of my family, and speaking for myself both professionally and personally, I want to say that I feel a deep sense of gratitude and also responsibility for living in these lands. You are joining us for our very first installment of the Spring 2018 Indigenous Cultural Safety webinar series. Today we're speaking with Emily Giguere, clinical planner for the Youth Substance Use and Prevention Services with Vancouver Coastal Health. Emily will be speaking with us today about her experiences and insights into developing programs from the ground up to be culturally safe and responsive and competent in working with youth. My name is Anata Harding. I'm Eastern Cherokee from Cherokee, North Carolina, and Italian and Irish. I work as the coordinator for Indigenous cultural safety training at Aboriginal Health, Vancouver Coastal Health, and I'm really excited to be speaking with Emily today.
Thank you. Thanks for having me. As Anata said, my name is Emily. I am originally from back east, so my own territories in Quebec. I'm also very grateful to be on those territories we are on the unceded lands that we are in. My background is, I would say, diverse in terms of professional experiences I've had. My own educational background is in psychology, as well as in complex trauma and Aboriginal focusing oriented therapy. I'm a clinician at heart, but also in a leadership position at the moment. And I work with every population there is, from children in school to working in a downtown east side, to working with individuals incarcerated, to now working with youth with substance use issues.
Very diverse.
It is.
Rich.
Yes. Yeah, it is.
In your role as clinical planner with Youth Substance Use and Prevention Services, you're overseeing 3 new programs.
Yes.
Youth Haven, Sequoia House, and Alder House.
Yes.
Give me an overview of those programs and describe to me some of your responsibilities.
Sure. So we now have within our services a continuum of services that come from a low barrier house to a detox facility to treatment services to supportive recovery to outreach, and which I oversee. And Youth Haven, Sequoia, and Alder House are part of that continuum. So Youth Haven is a low barrier house that opened January 15th. It is for youth between 16 and 19-ish. We're a bit flexible on that. And it is for youth who are struggling with substance use, who are homeless on the streets, who need a safe place to be. And they can come under the influence, that's okay, as long as they're safe. They can bring in their pets. And it's a place of connection. So the goal of Youth Haven is to connect them with other services.
Okay.
So sort of approach them as they are and connect them with other healthcare, with cultural services, with substance use, mental health, whatever the case may be.
Okay.
And Sequoia and Alder are 2 supportive recovery houses for youth, which are the first in Vancouver.
The first in Vancouver.
The first, yes.
Wonderful.
As well as Youth Haven.
Good job.
Youth Haven is also the first within BC of its kind.
Wow.
And Sequoia and Alder are for youth somewhat engaged in their recovery. They're committing to working on their recovery. And it is a place for them to transition back in the community, to work on substance use related goals, to work on life skills, just to build back their ability to be confident in living in the community and have the supportive staff to do so. So my role is to oversee those resources from a contractual perspective, but also from a clinical perspective, to either from program development to supporting services in-house, to complementing those services with our own team as well.
Okay. And so from a contractual perspective, I want to invite a bit more about that, because I know in speaking with Emily before that the really collaborative approach that Vancouver Coastal Health and its contracted agencies have taken with these programs is new. Hence sort of the newness of these programs, perhaps. Can you describe a bit about that?
Sure. So the services we're describing here today are services operated by nonprofit agencies in the community, and VCH is the funder and oversees those programs, but we also bring our own services to sort of complement them. So we really try to work as much as possible as one team, working with the youth that we work with and connecting them, whether it's with other community services or VCH services in the longer term when they transition into adulthood, for example.
Okay. When did you take up this position?
It was about 10 months ago,
wow.
In May of last year.
Less than a year.
Yep.
Okay. And you had shared with me before that at any given time, 40 to 70% of the youth that your programs are serving are Indigenous youth.
Yes.
Wow. That's a very high ratio.
It's a very high ratio, yes.
Tell us a bit more about the youth, both Indigenous and non-Indigenous, served by the programs.
Sure. So generally speaking, our youth are between 13 and 24. So as I mentioned in the past, we don't stop at age 19. So we understand there's quite a larger transition into adulthood that happens, and you don't instantly become an adult when you turn 19. So we do that. Nope, certainly not. So we do have our services until 25. A lot of our youth present with a significant amount of trauma. Due to the nature of our work, they have had substance use issues and mental health issues. But I'm going to say that trauma is certainly at the forefront of our youth. In substance use, I've always seen substance use as a way to cope. So it's a symptom, it's not the real issue. I mentioned earlier that somebody I really admire is Dr. Gabor Mate, and he often asks, do not ask why the addiction, ask why the trauma. And that really, really applies to our youth. And our youth come either with some support from their family. Most of them don't have that, so they tend to turn to their peers for that. They might be street entrenched. They might be in unsafe housing, situations. And they might, looking for that connection. I think most of them, wherever the situation may be, they're looking to connect. They're looking to connect to someone, to a tradition, because they tend to float around in our services without being really grounded. So they're looking for something that can help ground them.
Do not ask why the addiction, ask why the trauma.
Yeah.
Okay.
Yeah.
Do you think that the very high ratio of Indigenous youth in your programs is a result, in any measure, of the strong overrepresentation of Indigenous youth in the provincial child welfare system?
For sure, there's a very strong correlation, because not a coincidence that also 40 to 70% of our youth aren't here. So it is the state children. Our youth First Nation people have a long-standing history of having their children taken away, and our youth are those children. They are disconnected from their families, from their ways of time, and really trying to reconnect with their families of origins, or really trying to connect elsewhere. So the correlation is actually quite high. Yeah.
In your position of leadership, in less than a year, you've taken some very impactful steps toward ensuring that the programs are culturally competent and culturally responsive in their service provision to Indigenous youth. Can you tell us what those steps have been?
Sure, there's been a few of them. Some of them started before I arrived. Myself, colleagues of mine, and my supervisors created the first youth intensive case management team, which is a multidisciplinary team that basically is there to support the youth through our services as they transition from services to services. So they don't fall through the cracks, and then to make sure we provide the right service at the right time. So also through our consultation with families within the context of the redesign of our child and youth mental health and substance use strategy, we asked families what services they wanted. So that was a little bit before I started, about a year ago. And the families, what came across was an elder. Okay. They wanted an elder. So that's what the youth was asking for as well. So both professionally and personally, I've been involved with many elders, and I can certainly understand the benefit of them, having them as part of our team to inform the services and work with the youth. So I put together a proposal to hire an elder, including the duties and the benefits for the youth and the staff and the team and everybody else. I think we work with very diverse youth who have very different ways of and paths of healing. Their journey is not linear. It has ups and downs, and it has different things that they try to ground themselves. So we need to be really respectful of that. The traditional ways have been repressed and banned for years, for thousands of years. So let's stop that and use the traditional ways as a way of healing, which for me, myself personally, has helped me tremendously. So for some of the youth, there might be some resistance, and they may have been taught to sort of be ashamed of that. But we need to present those options, and the staff needs to be aware of the history. So another step we took is to talk with the staff and all the services to attend the ICS training, so that they are aware of the history and are more mindful of in their interactions with the youth, so not to re-traumatize them.
Oh, interesting. So so that I want to clarify or just touch on a couple of things. The integrated case management team that your teams are conducting are not just VCH or not just your contracted agencies, but it's actually formed of VCH and the contracted agencies. Is that correct?
Yes, like we do have VCH staff, which typically includes, and in our case, we're working with nurse practitioners who are part of our team and doing outreach and in-reach in those resources. So they're actually going to the youth.
Okay.
We have our elder on the team, we have myself, and we have a concurrent clinician as well as part of that. And we're in the process of looking at hiring a peer support worker as well.
Okay.
And we work in partnership with the contracted services.
Okay.
With their teams as well.
Okay. And then the Elder in Residence program was a direct response to recommendations that families and youth have made.
Yes.
Okay.
Absolutely.
And then the putting staff through the foundational Indigenous cultural safety training was one of the things that you had identified in being able to implement these measures effectively.
Yes. Absolutely.
Okay. Yeah. All right. And I know from our conversations before that, particularly given how complex and new these new programs are, that you and your teams needed to identify what components of the programs were essential to begin with before you even started providing services, and what components of the program maybe could be deferred until later.
Right.
And so the Elder in Residence program and ensuring ICS training for all of the staff, those were measures that you identified as being essential to get done ideally before you started providing services.
Yeah.
How do you see those as being essential to achieving program objectives?
I think for me, there's no other way. I mean, they are essential for us as professionals and for our youth as well. Our youth has been through so much trauma, including cultural trauma, cultural genocide, really, that we need to be aware of that. And we need to be aware of the history, not only the trauma, but the strength and the beauty of the people and the traditions. And we need to use that. I mean, First Nation people have lived for thousands of years respectfully in harmony and in an autonomous way. And then colonization took place because Europeans were afraid or feeling threatened by a way of life that they did not understand. So I would say it's enough. Let's just go back to the traditional ways and see how much healing they can bring. Because from personal experience, they've definitely helped me as well. And let's use those to help the youth that we work with. And I think, as I said, we need to take the youth that we work with where they're at and give them those options. They might be resistant because, as I said, they've been maybe at times taught to be ashamed of their ways. But let's provide them that option. And having an elder is somebody that they can speak to, they can open up to, and just somebody who can be just present with them and just sit with them and be there. So it might be less threatening for them as well at times.
So in the relatively short history of colonization, the ways of different Indigenous societies have been discredited, but they were working very effectively before.
Absolutely.
So you're advocating that they be reincorporated in.
Absolutely.
They worked before, they can work now.
Yeah, they've always worked.
Right.
Somehow somebody decided they didn't.
Right.
But they've always worked.
Right.
Yeah.
And you had shared something before that I want to underline, and that was that having your staff go through the foundational ICS training was also a measure you wanted to take to prevent doing any more harm.
Yes.
Before you even look at, bringing some kind of additional therapeutic or health promoting effect, you just want to not cause more harm.
Yes, that's very important. I think we there's a potential of creating more harm, not intentionally. As we said, we typically don't do that intentionally, but we can certainly do that through ignorance and just repeating very sort of microaggressions in a very subtle way that will affect the youth. So it's really important we don't do that until we start on the right foot.
Okay. Can you describe how you have seen possibly how your staff conduct their work changing since doing the foundational training?
Yeah, I think my conversations with them have been that they've definitely been deeply touched by the training and what they've heard. A lot of them found it really hard when they were not aware of the history of First Nation people. So they found it hard to hear that, and it should be because it's a horrendous history. But I think it helped them really understand more the youth that we work with, because when you work with youth, especially, you don't work just with youth. You work with all the previous generations before them, because they carry those generations with them. And that's when we speak about intergenerational trauma, but also wisdom across generations. And let's use that wisdom to work with them. So it's working, with not just one generation, but multiple of them. And what I've seen with the staff is that they're more curious about things. So they're starting to ask questions and wanting to connect with the elder, wanting to learn about the traditions. And I think a lot of them didn't have a safe place to ask those questions, or they felt they were stupid questions in a sense. And it's creating that space for them to do that and just really wanting to learn. So what I'm seeing is definitely more of an open-mindedness, that more present for sure.
And engagement in conversation?
Yes. Yes, absolutely. Like, can I ask you those questions? Can you tell me about smudging? Like, what is the meaning of it? How do you go about it?
Right.
A lot of them at those really sort of what they consider to be stupid questions when they're not, right?
Okay.
So sort of a smudging 101.
Okay. And you had also shared that staff are more reflective on their own social, cultural location, and the potential impacts of that on how they're approaching their work, and that they're identifying not that only to other staff, but they're actually identifying that in conversations with the youth that they're working with.
And I think that's a different way of doing things. A lot of people we work with are used to having sort of that professional stance, and with that, we think that, okay, well, we don't talk about our experiences and we just, stay very sort of objective. But when you do, for example, a circle with staff and youth, it's interesting to see the staff share about their own, struggles at times, and for the youth to hear that they're also human beings, and we all struggle at times, but we're all there to help each other. So.
It's exciting to hear this playing out in the real world, because as we've shared in earlier webinars, cultural humility, cultural competency, cultural responsiveness are practices of, in our cases, the healthcare provider. Indigenous cultural safety is an experience that can only be named by the Indigenous clients and their families.
Yes.
And that inherent in that is a shift of power to the client and the family. And this sort of humanity and equal engagement in conversation, and staff identifying themselves and being more vulnerable is illustrating a shift in power.
Yeah, it is, and it's really good to see, and I think it's definitely more needed. There's some fear around it for sure, but I think it can be really, really helpful if it's done well.
Wonderful. Yeah. Describe a bit about the collaborative work that you do with the elder in residence.
I think that the elder, his name is Blair, comes with maybe a different worldview that some of our staff are used to having, whether it's medical staff or counselors. And my role is sort of to complement his work and sort of be that bridge between this big system that is VCH, that comes with, a lot of procedures and policies in place, and his approach and his views on things, which are also my views, also my practices. So having both sort of the Western and traditional training, and sort of that bridge in between, and at times a moderator, because there is some resistance at times. Working in a multidisciplinary team has multiple benefits for staff and for youth, but also comes with challenges because people come in with different points of view on certain things. So it's sort of facilitating that transition and helping him do his work in a way that he feels respected, but also is in line with our services that we have, and being there to debrief or support them the best that I can, and that bridge of two worlds coming together, and seeing the benefits of both the Western ways and the traditional ways and how they can benefit each other.
Okay.
Yeah.
What impact are you seeing the Elder in Residence program having on the youth accessing your services?
I think that it's, as we said, I think it's sort of bringing a different perspective on things, and I think the youth, a lot of the youth, Indigenous youth, have been taught to respect an elder, and when they see him, it's somebody that they can talk to openly about things, as it might be less threatening than a doctor or a counselor, for example, but comes with that level of respect. So it's sort of balancing that, disclosing to him and feeling comfortable talking to him about certain things when they feel it might be a lack of respect, and him doing that work with them of it's okay, I'm there either way, whether you're doing good or whether you're struggling, I'm going to be there to listen to you and just be present with you. So I think it might be for the youth a different way of seeing things, and also very validating where they come from and their own traditions and their own values. And sometimes in the close conversation it brings back memories of their childhood. Oh, my mom used to do that, we used to do that tradition in my own territory, and then wonderful. Having somebody to talk about it with that, right?
Right.
Yeah.
And so I'm remembering what you were sharing earlier about the youth, Indigenous and non-Indigenous, that your programs are serving, being kind of disconnected and moving around, looking for something to hold on to and to ground them. And it sounds that, at least in the case of the youth working with the elder, that's a point of potential great affirmation and grounding.
It is, and I think that they're sort of grasping here and there, but definitely having an elder there to consult with. And as I said, also working with the traditional ways such as smudging. So all of our houses, as I explained earlier, have smudging available and openly available in the living room for everybody to use. And it's really nice when you come in the room and I open the door to Youth Haven, and the first thing you smell is sage. Because everybody's been smudging all morning, so.
Shared with me when youth smudges maybe all day sometimes.
Yes, that's multiple times during the day. When he comes in, when he comes out, before he eats, after he eats. It's just his way of grounding himself.
Yes. Yeah. The Indigenous Cultural Safety Training at Aboriginal Health is being contacted by more and more teams wanting training for their entire staff cohort. At the same time, a lot of the teams are feeling challenged, as you would understand, by budget constraints and staffing constraints. Having ensured that all of your programs staff have gone through this foundational training, what thoughts could you share with these other teams feeling challenged by those constraints on the value added of getting your entire staff cohort through the training?
I think there's a lot of it. I mean, I think it's a team building exercise for sure.
Okay.
To come in a different way together and let go of whatever ego you have and just be learning together and looking at your own biases, looking at your own stereotypes, and just looking at yourself and how you operate and doing that with your teammates. And in terms of the youth, it's really, as I said, to not cause further trauma. Our youth have been through enough. We don't need to put them through more. They come to us at this time in our lives for healing, so let's provide them to that, because they need that in their lives, and they need us to do that. And I think it helps the staff understand the clients a little bit better, and that everybody has a different ways and different paths of healing, and let's be respectful of that. And for me, what I'm noticing in the different programs is a shift in the energy, in the atmosphere. So staff are more a bit open-minded about things, and sort of maybe a bit more relaxed. And it's really sort of the beginning of a conversation that needs to happen. That needs to happen anyways.
Okay.
Yeah.
I am excited. We've managed to leave time for one question. So for those who have joined us in the video conference rooms, or anybody logging in from your computer, now's your opportunity to ask Emily a question if one is sitting in your mind. Do we have a question through the chat? Okay.
There you go.
Emily, this has been such a pleasure. Thank you very much for your considerable time and thoughtfulness in preparing for this conversation today. Thank you for your allyship over the many years with Indigenous peoples and for your leadership within healthcare. Breaking new ground is certainly what I've heard today.
Well, thank you for having me. Really a pleasure.
Wonderful.
Thank you.
Yes. And certainly the impact that you and your teams are having on the lives of youth is precious.
Thank you. I hope so.
Yeah. Thank you, everybody, for joining us. This has been a conversation with Emily Giguere, Clinical Planner with the Youth Substance Use and Prevention Services at Vancouver Coastal Health, on 3 new groundbreaking programs here in Vancouver for youth. And this is our first, as I said, installment of the Spring 2018 ICS webinar series. Please join us again next month, April 4th, when we speak with Heather Whitford, Master of Social Work and Registered Clinical Counselor, on her practice of allyship in therapeutic relationships with Indigenous clients. Have a beautiful day.